At UC Davis School of Medicine, to own it is to honor our great work, both as an institution and as individual contributors, and to acknowledge our unique strengths, skills, talents, and limitations so we can go about our work in a way that is meaningful, impactful, and done with integrity. Owning it means to work really hard at something, to have pride in what you do, and to take on great responsibility for your work. At the UC Davis School of Medicine, we recruit and train the best and brightest students who have a deep commitment to improving the health of our local and global communities. Our graduates here today are poised to make a real difference in the health and well-being of individuals and communities locally and around the globe. Throughout their medical school journey, our UC Davis medical students have owned many things that have not only helped them grow, but has also helped others do the same. For example, they have owned population health by volunteering at community clinics to provide vital care to underserved residents. They have owned inclusion excellence at UC Davis Health System by sharing their voices around the importance of diversity, culturally appropriate care, and access for all. They own the important task of encouraging young people from diverse backgrounds to pursue a medical education through such programs as pre-health conferences and underserved communities. And they have helped the health system own its future by being important participants in our strategic planning for the next 5 years and beyond. I asked members of our UC Davis School of Medicine of 2016 what they plan to own in the future. And it turns out they plan to take on the world. Take a look.
As a primary care physician and psychiatrist, I plan to own decreasing chronic illness and mental health burden in underserved communities in California and internationally.
I plan to follow in the footsteps of my mentors, surgeon scientists devoted to the best care possible for patients with cancer.
I'm going into internal medicine because some of the best teachers that I've had, the most patient-centered, student-focused, compassionate, nicest, smartest teachers have been internists.
From pre-op to the OR and even to follow-up years later, I want my patients to know that they are in good hands.
Over the last 4 years, Davis has taught us to become compassionate and thoughtful physicians. And they've given us increased responsibility over that time. And that responsibility is going to be much greater once we begin our intern year and our residency and as doctors beyond that. I'm confident that we'll all be able to face those challenges.
Own it.
As a pediatrician, I plan to own cultural humility by providing compassionate and comprehensive care to LGBTQ youth.
Own it.
I want to help kids own a brighter and healthier future. My goal is to become a pediatric intensive care physician so that I can be there to comfort children and their families during a time where they're most emotionally and physically vulnerable.
Own it.
As a future urologist, I plan to own compassionate and evidence-based surgical care.
Own it.
As a future general surgeon at a county hospital, I want to own comprehensive patient care.
Own it.
I also plan to own being a leader in health advocacy and joining the fight in decreasing healthcare disparities in these communities.
Own it.
I plan to own evidence-based, education-driven, patient-centered hospital care.
Own it!
I think it's time for us to go out and show the world what a Davis doctor can do.